All right, good evening, everyone. My name is Joshua Perkins, and I am the COO for Young Gifted and Green, environmental justice civil rights organization, which we focus in Flint, Michigan. That's where the organization was actually birthed due to the Flint water crisis. And we also work in Memphis, Tennessee, as well as Baltimore, Maryland, as well as Washington, D.C. And so today we are doing a lead-free future webinar. Talk everything about lead. We're talking about lead exposure, talking about we're doing a series. And so this is one of the topics tonight, the kitchen table defense, talking about nutrition and holistic health. And so tonight we're going to actually dive into that and kind of talk about that and hopefully talk about some good food and things that you can actually partake in that we're not going to say prevent you from lead exposure, but something that can actually help your body not to absorb maybe as much. And so if you come in contact with lead. So tonight I'm super excited to have with me. We have Bolin and we have Nev as well. I'm gonna do a short read bio and then I kind of pass it over to you guys to kind of lead the presentation here tonight as we move forward. And anyone who is in the actual meeting, if you want, you can put your comments or questions in the actual chat, and then I'll make sure I read those, or you can raise your hand and I'll unmute you and allow you an opportunity to speak if that works for you as well. So our first guest here tonight, presenter, is Bolin Amaru. I hope I got that right. And he is the Director of Health and Food Justice at No Boundaries Coalition, where he leads community-based programming in Central West Baltimore, focused on food access, workforce development, youth leadership, environmental health, and advocacy. Through initiatives such as Fresh at the Avenue, Team Acorn Youth, Workforce Development Pathways, and Community Health Workshops, Bowling works alongside residents to address structural inequities while building sustainable, neighborhood-driven solutions. In addition to his community health work, Bowling is a seasoned renewable energy professional with over 6 years of experience in the solar industry. He has led and supported solar education, workforce training, and community-based energy initiatives across the DMV region, helping residents and organizations understand clean energy, energy efficiency, and electrification as tools for economic and environmental justice. Bolin is also the co-founder of Alkaline Bodies Tribal LLC, a mission-driven enterprise focused on holistic health, sustainability, indigenous centered economic development. I'm sorry about this clock. His work bridges food systems, clean energy, and environmental health to advance resilient and self-determined communities. Across all his roles, Bolin is known for his ability to translate complex systems, whether public health, energy infrastructure, or policy, into accessible, actionable knowledge that empowers communities to lead their own futures. And so there we have it, introducing Bolin. Thank you so much for being here tonight.
Appreciate it, brother. It is a blessing and a honor to be able to be with you all, especially invited by the wonderful young gifted and green. I think you just froze there. Yeah, it looked like we may have lost you, but I'm sure you'll be able to jump back in. While we have a moment, I do want to give the opportunity for my partner, my longtime brother as well, in this work and also in life, Nev Hayel Shakur. He will be able to talk about Alkaline Bodies, our company, a vision that he was able to create with us all and be the leader and nutrition, the leader in knowledge and educating our community in regards to this walk here called Alkaline Body. So I'll give him a moment to introduce himself and then we'll go straight into our presentation for tonight.
All right. Hey guys, my name is Nev Hayil, and yes, I am one of the founders of Alkaline Bodies. I've been in the healthcare community in Baltimore doing the nonprofit side for about 10 to 12 years now. Food access, awareness, food education, food demos, anything around, plant-based eating, healthy eating, or just having food access or just awareness to how to get food, how to prep food, how to make food. That was a major foundation of Alkaline Bodies, strong in the Baltimore community for over 10 years. And, we're just happy to be here and happy to help.
Yes, sir. I appreciate you, Nev. And here we have a picture of our team over at No Boundaries Coalition. Shout out to them. I'm in the middle, our executive director, who is Ashia Parker, and our deputy director, Nabia Aziz, who are wonderful leaders in the 21217 community, which is going to be our focus of work today. Today, we're going to be discussing how can we protect the family from the table. And at No Boundaries, we do that through our Health and Food Justice Department. Our mission at No Boundaries through training, education, and base building, we deconstruct physical and imagined barriers in Central West Baltimore so that we can empower residents to lead and live sustained community transformation. And the Fresh at the Avenue Market is one of the ways that we're able to do that. When that community polled some of the things that they wanted to see change in the 21217, the number one thing was healthy food access. So through that programming over at Fresh at the Avenue within Pennsylvania Avenue Market, Nev used to serve as the market manager there, and he is now working at Civic Works. However, he still covers for me there on Saturdays. So if you're ever interested in meeting that brother, then for now you can come meet him over on Saturdays. But you can see this picture here of him hosting our workforce development class for youth that are 18 to 24 looking to learn their manager certificate for the Serve Safe course. And that is a 12-week class that we take a part of. And we know we used to do that about 2 times every year. However, now we're still looking for some funding to get it back going. We also do youth leadership development through our team Acorn, which is kids that are 9 to about 14 years old, preparing them for service and leadership within the community through working in the actual market. And we teach them everything from social skills to math and reading through the actual business. Everything from reading tags and counting apples to counting money and walking people to their car with their bags, just teaching them how to not just provide customer service, but just ingraining them into their community and everything around environmental justice and advocacy, etc. Now, what is Fresh at the Avenue? Fresh is one of the favorite programs that we host outside of our workshops where you can come get whole produce. And that market started because people have a lot of transportation limitations to get to food and limited grocery access, financial constraints, and health issues. So there we provide produce, smoothies on Fridays, and juices throughout the 3 days that we're open, Thursday through Saturday, ready to go healthy meals. On Fresh Fridays, we introduce other organizations that are health and environmental justice focused. One of the ones that come every week is the Merlin Food Bank, and they help everything from food down to SNAP and job security as well. And again, we have volunteer opportunities, our workshops, workforce development, and the buy-in club is something that we would like to get back running again, but it's a program that traditionally has run through Fresh, where we allow our 21217 residents to be able to buy in to bulk pricing for the actual produce that's offered to us from our producers so that we can get more healthy foods into the home at a cheaper, affordable price. Now, we're going to start getting in a little bit into the meat and potatoes about why we're here today. Why does this work matter, right? When you're able to provide healthier food at an affordable price in an area in the 21217 that faces low life expectancy, food insecurity, environmental health risk, aging housing stock issues, and lead exposure concerns, we want to make sure that people have the resources that they need, even though we may not be the people that are providing the wraparound services, right? Like the reliable healthcare or the preventable healthcare resources, or top of the environmental health education. We reach out to our partners like the Energy Foundation, like Interfaith Power, and Light for the faith communities, like Baltimore Public Markets, and tap into their partners so that we can be able to provide other resources that the city may have for the residents within that 21217 community. So we like to play the home base for our people and be able to push them towards the proper people. we're able to determine that people are going through these issues by utilizing the Baltimore neighborhood health profiles. I was hoping that Sadiq was going to be here today so that he can piggyback on that and talk a little bit more on the importance of people knowing and our residents in Baltimore City understanding that we have a resource from our Baltimore Health Department that allows us to be able to look up by neighborhood health factors that are affecting us. And lead poisoning is one of the main factors that they are looking at. And you can see how not only you are affected, but how Baltimore as a whole is affected and what resources are out there for your community to be able to take charge. Now, what is lead poisoning? Lead is a toxic metal that can enter the body through lead paint, dust, water, in the lead service lines, certain imported products, contaminated soil. And in children, they're the most vulnerable and they can go through things like bad behavior, growth and development issues, learning ability problems, and brain development being slowed down as well. Now, what you see to the right is a system that we use at Alkaline Bodies to be able to get a live snapshot of how your body's is your body's vibration reaction to heavy metals. And we'll talk a little bit about what that machinery is, but this is an example of a report that is showing the lead level being a little bit on the high end. And we can use tools like this to be able to, one, show people where they stand, and then also open up education to what resources are out there. Anything to add on that, Nev, or continue? All
You hear
right.
me?
No, I can hear you now. It sounds like you may be going out. Check your audio and let me know when you're back in.
Yeah, I'm good. I say you good to continue. Everything sounds good.
All right, cool. So, common signs and symptoms of lead exposure in children looks like some of the things we just discussed: behavioral concerns, hyperactivity, developmental delays, hearing issues, lowering in academic performance. And then with adults, it can be anything from high blood pressure to fatigue to memory issues, joint pain, digestive concerns, and mood changes. Many people don't show any symptoms at all. So that's why it's important to be able to know how you can get in contact with people like the Baltimore Health Department to be able to get your children tested properly or get yourself tested as well so that you can know exactly if you're at risk. Now, why are we here? Right? It is a pleasure to be in West Baltimore and, walk around the neighborhood and try to provide service. And then people be like, yo, there go the fruit man, or there go the fruit man, talking about me, Nev, and our team. And it's important to have that type of recognition because people know and trust that we are going to be able to provide them the proper education around the things that they're looking for, but also give them access to things that they are not normally getting accessible with the markets that we have in the 21217 and beyond in Central West Baltimore. And I say that to say that food alone can't cure the actual lead poisoning or prevent it by itself, right? Food, though, can help reduce lead absorption, especially how lead is being consumed, whether it's from dust particles or paint in the actual home, or like we said, the water lines. We want to be able to combat that actual lead absorption. And we have to do that through diet and exercise. We also do that through strengthening our immune functioning. We help educate people on detoxification pathways. Within our store, we make sure we have things like ginger, turmeric. We make sure we're letting people know that they should be using spring water with those things and lemons and limes so that they can create a good gut health environment so that they can combat various issues But again, this is something that you would want to actually do as well if you are in an environment that has lead exposure. We also want to protect our organs from damage and also improve our overall body resilience. A well-nourished body absorbs less lead, and that's our goal. Now, some key nutrients to think about to protect us against lead. Calcium competes with lead for absorption. Iron, low iron increases lead absorption, and vitamin C improves iron absorption. So these are the three main factors that we try to help with the actual inventory that we have at our store. And that consists of things like kale, collards, mustard greens, broccoli, excuse me, we don't actually give dairy products at our store, but you may have an opportunity to get them at other markets, but we would recommend you try to stay away from dairy products and more so try to supplement calcium instead of trying to ingest dairy, which is why the last thing is fortified plant milks. For iron, you got your beans, your lentil, your chickpeas, your leafy spinaches, and then also your lean meat. Specifically, we would recommend you take a look at bison. Vitamin C. We have your oranges, your lemons, strawberries, your bell peppers, your grapefruit, all of that our 21217 residents and Central West Baltimore residents have access to on the weekly basis, on top of the beets, the root potatoes, sweet potatoes, and yams. I already talked about the ginger and turmerics, the herbs that we host there, the thyme, the rosemary, the mint. We rotate these things out for best price, but again, we make sure that you have the knowledge, but also you're getting it into your body various ways from Nev hosting soups for ready to go meals to our fruit bowls down to the juices and smoothies that we provide weekly. Now I kind of went into that here, the greens and all that we have there, beets, carrots, sweet potatoes, the ginger, the turmeric, garlic, and onions. The key here is making sure that we're adding the vitamin minerals and the antioxidants to the body that we may not be getting by eating a processed diet. On top of that, the key is eating a non-inflammatory diet, adding things like cayenne pepper, turmeric to your actual meals so that you can be able to fight off those heavy metals. This is more so where I would like you to jump in there. Any other whole foods that we could be able to add to this list to assist?
Really, with foods, mostly just like grains of those natures. But if you already have grains on there, that's, a major thing that helps build chlorophyll and, help the detoxification system.
Grains, give me some examples. Quinoa, spelt,
Uh, so like Swiss chard, dandelion greens, purple kale, things of those natures.
great. And one of those, the chart we actually get from Strength to Love Farm. Shout out to them. They have local greens that you can be able to get access to right there and off of Monroe and Kavanaugh. So to continue to build on the whole foods, Fresh at the Avenue is a focus on whole food diet, making sure that people are getting the natural, actual produce and finding the good ways to be able to make it non-inflammatory. And we leave recipes within the store so that people can actually have some level of education around what to do with it. And on Fresh Fridays, they can actually come down there and see us actively making some of those meals that consists more nutrients, more fiber, better blood sugar control, which is an issue again if you do already have lead poisoning, better immune support, and reduce that inflammation. Ultra processed foods are high in sugar, high in salt, low nutrient value. It increases that inflammation and gives you a greater chronic disease risk, allowing that actual lead to be able to do more damage. We get our data from the actual neighborhood health profiles that I spoke about before. These reports help communities understand local health challenges, identify environmental risk, help us advocate for resources that are already listed there, but also find holes by speaking to the community, sending them through the actual wraparound services and get feedback so that they can actually improve said system. That is a project we did with the John Hopkins Public Health students this year by looking at the report, hosting some listen, lead, share meetings, and seeing exactly what the community knew about this report, where were some holes, and what can be added. These profiles also, more importantly, look at childhood lead poisoning, housing conditions, asthma, chronic disease, food access, life expectancy, and environmental health concerns. Now, some of the resources that are available is Baltimore City Health Department. Again, you can go to them to be able to get yourself and your kids tested. The Childhood Lead Poisoning Prevention Program has a lot of great resources for that as well. You can go to the lead inspection services through Baltimore City to be able to get your house inspected as well. And there are other housing resources and environmental health programs through organizations like Green Healthy Homes initiatives, and they also have some rebate programs as well. Community health workers is a great start. And for example, in West Baltimore, we have the Druid Hill YMCA community health workers team that we would refer people to. But you want to, again, check your Baltimore City Health Department website, check around for where there are local community health workers in your community, and be able to see what resources are available to you. So I'm going to show a couple things and give a quick overview of how does Alkaline Bodies as a company utilize this information to educate, right? And the report that you all seen a few slides back, I'm gonna go there real quick. This heavy metal portion of the analysis report card. This comes from a machine that we utilize, a non-invasive machine that we utilize at Alkaline Bodies to be able to get that live report. And it gives us indicators on everything from healthy metals, cardiovascular health, digestive health, nutritional deficiencies, organ function, and stress and inflammation markers. And this is important, right? Because lead cannot show symptoms at times. So this type of machine is being able to show us various functions of the body that connect to each other and be able to see exactly how you're being affected. Now, our job is on the community side, it's more so providing you, the resident, or you, the client in this regard, the information, right? It is your information to have. It's not something that we sell or keep, but we utilize that to be able to educate or find the people who actually do the testing to be able to recommend the proper meal plans, to recommend the proper testing based off of your results. And we go ahead and refer you all. When residents are going through this screening with us, we're asking about housing condition, water sources, workplace exposures, school and children environments, and lifestyle nutritional habits. Now, I want to show you an example of said thing. Here we have again a lead reading. This is my specific report, so I'm okay to share that. And it gives a little feedback on what blood lead generally is and what are the actual safety standards to watch out from and how many micrograms per liter you should or should not have within your body, right? This test also is able to measure vitamin C absorption. See, I'm underproducing a little bit here. We also said iron deficiency can be an issue in regards to lead exposure. And here we also have a trace element report card where we can see your iron and your calcium readings as well. So imagine when we do these workshops, we're able to come into a community, do these scans for free. And though we aren't diagnosing people, we are able to educate them about what these levels mean, what can be happening in the home. And through our surveys and open discussion, we're able to then get feedback and use that feedback to then go to our partners like Baltimore City Health Department and I told you the John Hopkins public health students to be able to use that data to actually see does it match with the Baltimore City health neighborhood profiles? And again, how can we help people get to the actual resource and doctors, testing, etc., that they need to be able to get these done? But these live reports allows us to give them something physical and visual to see, rather right in their home where this lead paint may be existent or right by the water source, wherever it may be, it's very effective in our teaching as far as our business is concerned. Anything to add there, Nev?
And then Bowling, you got that report. How can you explain it for me one more time?
Yeah, I'm gonna pull it right back up real quick. So we use a machine that is called a quantum magnetic analyzer. It's a small machine that has an electrical rod. You can still see me on the camera?
Yep, I can. Yeah.
Okay. Sorry, I talk with my hands. People always say you just like your father, boy. You talk with your hands. But I we use a metal rod. And this rod in the machine is doing a vibrational reading of your major organs.
Mm,
And through that reading, it is giving us a color code, letting us know if you're normal reading, if it's moderately abnormal, meaning that it's on the higher or the lower end too
okay.
far, if it's mildly abnormal, if it's a little bit off of normal, or if it's in the severe.
Okay. This is
And
good report.
yeah, it's amazing. You see, it's 105 pages.
Yeah, I was noticing that. Yeah.
It goes through a lot of various different things, everything from your blood sugar down to cardiovascular, down to your vitamins, right? If you're short in various different types of vitamins, down to if your shampoo is too chemically advanced for your scalp, we'll be able to see
Mm,
that as well. So all of
wow.
these readings are very important, but more importantly for today, it's a live lead reading instead of us guessing, right? But there's other places, more better places, I will say, as far as the health department and certified doctors that can do this testing for you. We're just using it as an education platform for communities. And while we got a second, Josh, was there any other questions that have been presented?
No, none at all.
Okay, cool, great.
Now, I do have one quick question. So, with this ride and the machine that does this reading, you can bring this along and do it at any community event. Is this something that can be done at any point in time?
Yes, we can do it from at any type of platform at a community event. Ideally,
Okay.
that's what we would like to do, down to doing it right in your home. Our actual mission is for to have a scanner in every home across the country. We just need to educate people about it, right? And show you where
Yeah.
to get it. And you can have it just like we have it. Nav just so happens to be a longtime friend of mine and a roommate. However, we give tests to each other. You just seen an old test of mine in November, but every couple months we'll go ahead and do a test to see where we are. And it's right in our home. And we would recommend people to do the same. That way you can, as is listed here, that way you can go to get tested by the Baltimore City Health Department. Or my mom, she takes her reports and she takes it to the doctor as an extra
Okay.
resource because a lot of time we don't come in with any knowledge of what's
Right.
happening with our body. And our doctors are normally testing based off of what we may have came and told them or whatever they have access to. But if we can give them a full listing of something that they can take a look at and may use or may not use, it's just doing all we can to be prepared as healthy individuals.
Correct.
Great. So it's also a great tool for us to be able to, depending on what we're seeing on said reports, recommend that you get an environmental inspection on your home or speak to a certified health coach that allows you to talk about nutrition, hydration, exercise, stress reduction, maybe anything down to going to speaking to a counselor, down to just taking a 2 mile walk a day, right? And getting outside, getting some fresh air, meditation, and the biggest things that we talked about before, whole food diet versus having a very primary processed diet, and start working the inflammation, dieting, and things of that nature into your regimen. So, we are landing the plane, ladies and gentlemen. And what do you do if you suspect lead exposure? First thing, as we said, you get tested. Children should receive recommended blood lead testing. Again, the recommended place to do that is with the Baltimore City Health Department or the Child Lead Prevention Program. And you also have the 211 actual Maryland number, which is the Health and Human Resources number that you can reach out to. Specifically, they have over about 7,500 resources there. And you want to at least reach out and get your name in line with the things that you need. And don't have that other bullet point there, but I would also look into, again, your local community health workers. Your report concerns are chip paint, especially that chip paint that is around like your window sills. You want to watch out for that with kids and making sure that you're pointing that out when you have inspectors come out to your home, especially unsafe rental conditions. We don't want to keep our mouths closed just because a landlord may have been good to us, or we don't want to shake or rock our situation, our home situation. At the end of the day, we want to make sure that our bodies and our minds are protected. And the best way to do that is making sure that we start with our home. And if your landlord is not taking the proper ramifications to make sure that your house is safe in regards to these issues, then you want to make sure that you're reaching out to those organizations like Green Healthy Homes to one, get checked, but also see where there is assistance with landlords. Water concerns and environmental hazards. I think we talked a lot about that. All right, so to bring it back home, Again, our goal at No Boundaries Coalition and also Alkaline Bodies is food justice equals health justice, environmental justice equals community justice. These things work in tandem with each other. And as long as we're continuing to educate each other on fresh, healthy food access, you want to make sure that you're following the city's food pack, which essentially is all the various different open free food areas. They are providing whole foods at these areas. We know that economics are rough nowadays, so it's great to be able to look at that listing. And again, you can see it on the Maryland Food Bank website, and make sure that you show up. Now, we do have, I realize that we may not get feedback based off of our platform is how our platform is today. However, I do want to leave you all with some questions, one to ask yourself, and if you need some guidance after answering for yourself, and looking around to see what access that you may have or do not have, please send your answers to us. Whether you are able to get in contact with us or through Young, Gifted, and Green. I want you to take a moment to think about these questions and your answers and be able to get back to us so that we can make sure that we find a way to be able to get you the proper resource that you need. Those three questions are: what barriers make it difficult for your family to access healthy food? What environmental health concerns do you see in your neighborhood? And how can organizations like No Boundaries Coalition, Alkaline Bodies, I would add in there Young, Gifted, and Green, and our partners better support your healthy journey?
Those are great questions. Thank you so much, Bolin,
Appreciate you, brother.
for going through this presentation. Thank you, Nev, as well. This is good stuff. Thank you so much. Of course, if you'll share this presentation with me, I'll make sure to share it as well as, follow up if any questions come about. This was good information. Also, we will be hosting the third series coming up soon. So I'll make sure I send it out to everyone as well. So we want to have that information. Um, no questions came in the chat. I don't see any. But thank you so much. And like I'll be able to give some time back tonight to everyone. So that's great. I will be in touch with you, Bolin, about some other things as well coming up that we have coming up in person that'll be taking place, I think at you all's office location at Unity Hall. So I will be in touch. Thank you everyone for being here tonight. If there's nothing else, I don't see anything in the chat. I'm gonna give you some time back. Thank you guys so much and be safe.
Same thing.
Appreciate it.
All right, thank you.